Hey everyone, this is Anna Herndon. I decided to discuss the Code of Fair Testing Practices in Education. It's divided into 4 parts, so you have developing and selecting appropriate tests, administering and scoring tests, reporting and interpreting test results, and informing test takers. The code is used for professionals to guide them in using tests that are fair to test takers regardless of age, gender, disability, race, ethnicity, national origin, religion, sexual orientation, language background, or any other special considerations. Our textbook also discusses ethical considerations in psychological testing. Most governing bodies have an ethics code to follow. You have the American Counseling Association, American School Counselor Association, and where this document comes from, the Joint Committee on Test Practices. And again, that's where the Code of Fair Testing Practices in Education comes from. So gathering information is an important part of the entire therapeutic process. And testing is just one component of that process, as we learned in earlier week modules. So the code stresses the importance of providing evidence on what the test purports to measure. So your reliability, your validity, all of that good stuff. And the precision of test scores, which is also important. And our textbook talked about that too. It's also important to inform test takers about the intended purpose of the test. So I chose to do the Eating Disorder Inventory 3 for my test critique. So before I would give that out, I would make sure that I was only giving this to patients or to clients that it was relevant to. So I wouldn't give the Eating Disorder Inventory 3 to someone that does not struggle or appears to struggle with an eating disorder. One of the most important points the code discusses is to avoid using a single test as the sole determinant of decisions about the test taker. And again, I feel like that's something that we discussed through the entire course. Gathering information about the patient has many forms. We went through an initial interview. We did one of those. We picked out tests to use on our client, and also the interviews, the tests, and counseling sessions. Those are just to name a few. And it's important for counseling professionals to not base their diagnoses or clinical decisions just on testing. Our textbook talks about that. The code that I chose to use talks about that too. You want to get your sources from you want to get your information from many different sources. There we go. And finally, the verse that I always come back to throughout this whole class was Philippians 4:8, and that's the King James Version I'm going to be reading from. So finally, brethren, whatsoever things are true, whatsoever things are honest, whatsoever things are just, whatsoever things are pure, whatsoever things are lovely, whatsoever things are of good report, if there be any virtue, and if there be any praise, think on these things. Again, in our first discussion board, this verse just really jumped out because as counseling professionals, especially if we're going to be operating under a Christian worldview, it's important to choose tests that are true, that measure what they say they measure, that are valid, that are reliable. You want to pick tests that are fair, that whenever you're looking at the norming populations. I know one thing with the Eating Disorder Inventory 3, the test that I chose to critique, the norming data was not great. So it took participants just from 4 countries, which, okay, that's better than just one, but it was only for females, so males were excluded. It didn't take sexual orientation. It didn't take ethnicity. It had no multicultural considerations included in the norming data with a test manual and really in any of the other studies that I looked at. So there's not going to be a perfect test, but it's important, especially like I said, for Christian counselors and ones that are going to operate with a Christian worldview to choose assessments that are true and that are fair and that purport what they, what am I trying to say? That measure what they purport to measure. There we go. So anyway, that was the code that I chose, and I've had fun in this class, and this video really gets me out of my comfort zone. So I hope you enjoyed it. Thank you.